We know that mental illness around the time of delivery, before or after, can have really, really severe consequences, both for mums, for families, other partners, but also really, really importantly, it can have really long-term debilitating consequences for kids.
Myself and one of the lead nurses for quality in the CCG, over a coffee really got together and kind of looked at what we could do. We knew that there was no additional funding in the borough, but we also knew that if you get professionals together in a room, you can often generate lots of ideas. And at the first session, we very much asked them all what they did, what services they thought were in the area, and started to map out what was actually on offer. And by doing that, we realised actually there was a lot more than each of us knew about. So just that opening up and talking to each other gave us a really good insight into some of the services that were in the borough that we didn't know existed as professionals.
Didn't require a lot of money. Money would have been lovely. We also knew that the NHS were really looking at perinatal mental health, and they had big plans around investment, and that we were very likely in South West London to be applying for additional funds. Therefore, we felt this was the right time to really try and get people together and really think about how we could support families.
So it has not been an initiative or a network that has been driven from the top down. It's a network that has evolved through genuine desire to improve services in Sutton. So it's a collaboration of health professionals working in the field, of commissioners from both the CCG and the London Borough of Sutton, but also service users, the voluntary sector. So a very wide network of individuals and organisations who really want to make a difference to Sutton.
Initially, most women, or all women with any mental ill health, were referred to my clinic. And a lot of the women with sort of mild depression, mild anxiety, not medicated, or previous postnatal depression 5 years ago were being sort of missed because they weren't being seen in the specialist clinic that I run. They were being seen by community team, where I feel that now, with that involvement with Uplift and having that direct contact, these women can be referred to Uplift a lot earlier on. I think there has in the past been a gap for women knowing where to seek help. We discharge at day 28, and a lot of women may become poorly 6 weeks, months down the line. And it's really beneficial to know that actually I can liaise with health visitors who will look after that family till the child's 5, and actually say antenatally this family would really benefit from baby massage, or this family would really benefit from support groups, and getting the ball rolling antenatally to prevent these families sort of being missed and then becoming really poorly and family breakdown.
The work of the network's been really important because it's enabled all the services to come together and share what work they do with perinatal mental health, raise awareness and really promote collaborative working. The PIMHN London Perinatal Mental Health Service, they funded some training and we managed to secure 5 places for professionals in Sutton. From the autumn we will be able to roll out a multi-agency training.
The health visiting team were telling me that lots of women in the perinatal period were too afraid to come forward and make a referral to Uplift or make a referral to our psychological therapy service because they were so concerned that their baby would be taken away, that they would be deemed as crazy or mad, so there was a lot of stigma around mental health.
So I think what we would hope is that we're really raising the awareness in Sutton across all professional groups and the voluntary sector, and really that if they come across a mum that they might be worried about, or that mum says actually she's not feeling well, that actually they would have the confidence to be able to talk to them about how they were feeling, and then to signpost them to the most appropriate person.
I think it was really good that there was an element, or a very strong element, driving element of collaboration at the meetings. So lots of people from different areas of expertise came together and kind of thought, let's do what we can to change things and make improvements where they're needed. Certainly, I think there is a need for peer-to-peer support in the borough and nationally.
I think that what the network has done is brought together people who've got a passion for making things better for families together, and working more collaboratively to try and make sure that services are seamless. We've always had good, positive relationships with our local partners, but coming together to tackle some of the issues and gaps that we knew were there has made a real difference to those working relationships.
This is something where frontline professionals themselves have been given that little bit of space, that little bit of opportunity to say, here's a problem, we recognise there's an issue here, how can we work together?
So I'm really hopeful for the future from this network, because I think it's a brilliant example of integrated working. It's formed strong links between all of the different providers, and it's a really proactive model. It's about supporting mothers and fathers and their young infants at a time when early intervention can make a big difference. And I'm really hopeful that this is going to have a fantastic impact on mental health for the whole borough going forward in the future.